Movement is medicine. Let's look at that idea. Physical movement, exercise, we're moving something. What is that doing? Well, we could start to list the physiological responses that we know that come as a result of movement. We can use that medicine as a prevention or as a cure, as a healing art. So, of course, here we are, a lot of lifestyle medicine, understanding the benefits of regular exercise, even taking aside the debates about how much we should do and what sort we should do. The bottom line is some form of regular exercise is beneficial to us. There's little argument about that. And it can be beneficial cardiovascularly, can be beneficial for our mental health state, can be beneficial for bone density. Movement is affecting the density of bones, it's affecting how actually our body constantly regenerates. Every cell of our body is replaced every 7 years. There's not a part of us that hasn't been alive for more than 7 years. It's amazing. And how is the new structure formed? How are muscles formed in response to how we load them? If we don't, they atrophy because they assume they don't need to be used. Our circulatory system responds to movement. We increase our activity, then we increase circulation. This is beneficial because it starts to move nutrients around the body, to oxygenate the body and keep it alive. So many physiological levels. Movement is important, either as a prevention and also how movement or even understanding what movement we need might be important for repair. It might be that we need to have an absence of movement for a period of time, short period of time. If I look at it as a craniosacral therapist and somebody looking at, say, the energy of the body, then there is a rhythm. There is a basic rhythm of expansion and constriction within the body. Many teachers have spoken about this in different disciplines. There is a movement. There's a movement constantly of our breath. The heart is constantly contracting and expanding, contracting and expanding. And our whole of our being is doing that like an amoeba. Most life forms have this contraction and expansion. What about our nervous system? Nerves that fire together, wire together. That idea of neuroplasticity. Dying off of old networks that no longer are required and potentially breaking old habits, potentially important in the resolution of addiction. How the nervous system is morphing and changing neuroplastically is also movement. And it is in response to movement, with the load we apply to it. Whether we're practicing a piano scale, we are loading our system and our body responds. So it's just how we view movement. I'm not just talking about moving my arm about necessarily. If we have trauma, for example, then we know that the body tends to shut. And when it's motionless, then we have big problems. So the lack of movement in the body has so many physiological responses. In the nervous system, if we've got trauma, we shut down. Very often what we're trying to do is to just help some kind of movement of that nervous system into either constriction or expansion, both of which can be very, very difficult and frightening and terrifying for an individual to experience. But without allowing and supporting the system to be able to move in some way, then often traumatized patients remain stuck in their nervous system. So energetically, physiologically, psychologically, what do we consider movement if we don't challenge ourselves, if we're not constantly looking to try new things, looking at adventure? Somebody that doesn't move forward in their lives is stuck. And it's not good. It leads to depression, it leads to all sorts of problems. So movement really is medicine. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.